All right, time now to visit with our doc, Dr. Kevin Kavanagh. He is a retired physician and is also the founder of a national organization called Health Watch USA. Good morning, Doc.
Good morning, Jack.
Good to have you with us this morning.
Thank you very much.
I understand that the CDC has released new data on initial Omicron cases.
Well, they have, and it's both encouraging and discouraging. 43 total patients were initially infected with Omicron. 37 of those were vaccinated. Now, for those out there, don't go saying, mainly unvaccinated. You need to realize most of these initial infections were in people who had traveled abroad, and that in itself would mean that most of the people are going to be vaccinated. But also of concern, 14 had boosters. There was only one hospitalization. Hopefully that was in the unvaccinated group. And of note, of good news is that all of the rest had mild symptoms such as coughing and fatigue. Now, in the United States, we have 61% of our population that's had 2 doses of vaccine. However, 25% have not had a booster. And of course, as we've talked before, it's really of importance that if you've had the J&J vaccine or if you're 6 months out from an mRNA vaccine, that's Pfizer or Moderna, you need to get a booster. That is extremely important because you want to make sure that if you do come across a variant, that you wind up with mild symptoms instead of winding up in the hospital. Kentucky, we're not doing as well. We're only 53% fully vaccinated. And I should note that as a whole, when you look at the United States, we've now dropped down to 60th in the world in our vaccination level. So wow. It's not good. We are really underperforming the world, and we're doing this by getting caught up in misinformation and political strife that in most countries does not exist to the extent that it exists here.
And the United Kingdom scientists urging more restrictions to fight the Omicron surge, right?
Well, they are. They've instituted a mandate for masks to be worn indoors, requiring vaccine certificates in order to enter nightclubs, and people are urged to work from home. Now, I should add that when you say milder symptoms with Omicron, many people are worried that these are in people that have already been immune to the virus, and that if you haven't been exposed to the virus or if you haven't been vaccinated, you may well get severe disease. At this point, we just don't know. Certainly, England is seeing a spike in cases. That could just be because Omicron is so infectious that even though it causes severe disease in a small number of people, if you infect a large number of people, that small number becomes bigger and can bring down your healthcare system if you're not particularly careful and start to abide by public health advice. So this is what we need to do in Kentucky. We need to get vaccinated or previous infection. You need to get either a booster if you've been vaccinated. Previous infection, please get vaccinated.
Do you think that the 2 vaccinations, not counting J&J, the 2 vaccines plus a booster should be considered fully vaccinated as opposed to just the 2? You do?
Yeah, definitely. There's no question about that. Many vaccines, and we've gone over this before, like hepatitis B, polio, requires 3 doses. And if you notice, Jack, on the 3rd dose, there's an increased incidence of lymphadenopathy, not an increased incidence of other types of side effects, just lymphadenopathy. And that may well mean that you're getting a lasting and enduring immunological response. So we're hoping that 3 doses will give you a longer lasting type of protection. And certainly if it's causing mild disease with these variants, it's worthwhile getting because we don't want to have our hospitals filled. But nevertheless, you still need to abide by public health advice because we don't want to overrun our healthcare system at this point. Especially in Kentucky, we still have too many immunologically naive individuals to go around and have life as normal, holidays as normal, and expect our hospitals not to be filled.
As always, a pleasure. Before we let you go, one other thing, Britain is battling the worst ever bird flu outbreak with 500,000 animals.
Well, that's correct, and that is worrisome. Number one, it kills off birds, It rarely jumps to humans, but unfortunately, when it does, it's 60% fatal, but it doesn't transmit very well in humans. Now, if you want to talk about gain of function research, Jack, in the lab, they've merged that virus with a human virus and have now an infectious virus that is 60% fatal. And that's the type of gain of function research that, in my opinion, just should not be done. So we may have other types of pandemics in the future. When we get through this one, we still need to be prepared for the next.
Always good to talk to you, and we'll talk to you on Friday. Thank you, Doc.
Thank you, Jack.